we asked all of you to, in your preparation for your talk, to give a key message. So maybe it's good to invite DJ and Catherine, Yongjie, and Eric. A key message for breaking down the silos, and we have detractors in mind. Maybe you are inspired to give some kind of reflection after you heard everyone's contributions. You heard the contributions from our audience. So I'll do it in the same order as the speakers. So DJ, would you like to go?
Yeah, thank you very much. I just would like to come back to the tractors and the political issues. We talked about the cost effectiveness and the return on investment of what has been done. And of course, as Eric just said, when there's multiple factors, it's extremely difficult to move to conclusions in the field of the economic health analysis of what is done when you break down the silos. But what is great now is that we have many new framework, and especially one that is called the social return on investment, that counts the price of all the dimension. For example, loneliness of old people has a huge cost from a social point of view. And when you count the return on investment, you have to take that into account. And I just would like to share you a few slides. The first one is about young people. When you work, at a community level in a health promoting school and community approach, you can demonstrate easily that multi-component intervention based on partnership between the social sector, the health sector, and the education sector has a return on investment much higher than the interventions that are done only by one sector. This is also true at the other end of the life. When you generate interventions at a local level, having together the social sector, the health sector, and the community workers, you have a very high return in investment, and especially the case when it's about home care and help. And I really like, the incredible work of Jonathan Silas and our colleagues from the Center for the Economics, at OECD and WHO. Clearly they show that these intersectoral policies that aim to promote the health of old people, for example, are key components of the sustainability of our social security system. So this is clearly one of our tractor. One of our tractor is the cost effectiveness of what we are doing from an intersectoral point of view that would help the different states and the EU to guarantee the sustainability of our welfare states.
Yeah.
Over to you, Rolf.
Thanks very much also for your additional slides, although we didn't talk about that, but it's really strengthened your case and the tractor that you suggest. Catherine, what was your key message or takeaway or, learning?
So especially after hearing everybody speak, I think my key takeaway is continued collaboration across silos, and I'm specifically thinking of within EUPHA. So we have different sections within EUPHA that focus on different areas of public health. And I would just say that in the EUPHA Health Literacy section, we are very open to collaborating with other sections, and I think that's something that we should really prioritize and continue doing, so that we don't end up with such siloed thinking or any duplicated effort, but we're very open to working together so that we can take a sort of a mini supersetting approach in the way we work, I guess.
Great. Yes, thank you. Okay, good. Yongjie.
Yes, great. Such a great discussions and comments from our audience and participants. I think I learned a lot from our panelists, and I have three key messages I learned from them. Of course, Didier mentioned how can we create the right conditions for collaborations, and what Catherine, you mentioned from the ground up, because at the city local level, we know what we need to do, and it's about bringing the right people together. And what Eric says about the voices of the people must be heard, and their needs to be accounted for. And I think when we talk about cities and communities, it is where we live, work, and play. And so this is a important areas for collaborations, and the Age-Friendly Cities and Communities Network essentially is the ecosystem in which we can actually speak the language to bring people together. And so our principle is nothing about us, nothing about us without us. And I think this was something that I think someone also echoed before, that if we come together, we can bring the solutions about how we can create change. One example, that I can give was, this was during the pandemic in Northern Ireland, which in a very impoverished neighborhood where older persons are, in the lockdown. They're not allowed to go out because of the restrictions. And what the community did was that they know all of the older persons, so they actually create a care package they call Hug in a Box, and to provide all these informations on health and literacies, and so that they can digitally connect with people. And the cost, as what Didier mentioned about, it actually doesn't cost anything because it's all run by volunteers, because they already have this network, the ecosystem to bring people together, and they were able to respond very quickly, even in emergency situations. And there's lots and lots of examples around the world, and not just in high-income countries, as I think one of the comments from Sebastian. Age-friendly cities exist in every communities all around the world. If we bring people together, we put people at the center, the solutions, the innovations will come. And that's why I think we need to also build the case for this common language, the system, the mechanism to bring people together.
So rather a people's movement than a tractor.
Yes.
Thank you very much, Yongjie. And Eric, what would you...
I mean, my message would be that public health must be disruptive. We must be disruptive. And so silos are basically the routine of our administration, of our bureaucracy. It's normal. We all have our routine, and the silos are basically the expression of those routines. So our tractors, I would say, are people who got engaged. And those are our tractors. So the people, when they get engaged, they actually can move things quite fast. We've seen it happening many times over. That's how revolutions takes place, basically. And so, and for this, we need community health workers. I mean, if we think of the local level, so community health workers that are able to create new participatory spaces. If you don't create those participatory spaces, you don't engage people. People don't know each other. They don't connect. You don't build actually their capacities to disrupt basically the routine of our system. That's what I would say.
Right. Thank you very much. You say it all. Public health must be disruptive. Maybe it's good also to have you, Iveta, to give your take on this.
Thank you very much. Yeah, I cannot agree more with my colleagues, because I think you said it all what I had in my mind, like what are the possibilities of breaking down silos. And despite the fact that, of course, the economics has a strong and powerful voice, I would say that also collaboration, communication is also very important, and especially collaboration, cross-disciplinary, cross-sectoral collaboration, as was said. Because I really believe in innovation, and I really believe that if we collaborate across sectors, across disciplines, we can bring the innovation, we can touch upon the untapped, potentials, resources. And I would say, like Sandra Galina also mentioned on Monday, that we have to find, like a public health community, also to find ways how to collaborate with the private sector. And so far, we've been a bit kind of like, we did not want to get our hands dirty, but I'm very happy that, for example, in the WHO, I see already this term that, there is this there are private actors where there is a lot of development in AI, in genomics, in precision medicine, even in social innovation. And the development will go on even without us. So I think we just really have to be clever how to collaborate also with these sectors to capitalize on innovation and to create the innovation ecosystems. And I think we really have to find a ways how to do that cleverly.
Mm-hmm. Thank you.